Hi everyone, and welcome to another episode of Excela Health Virtual Mall Walkers. May is observed as American Stroke Month, and as a health system, Excela Health wants you, our mall walkers, to know the signs, symptoms, and risk factors for stroke, as well as how to prevent a stroke. Walking is a great way to reduce your risk of a stroke, which brings us to today's walking journey activity. Are you ready? Let's get walking. Today, we're headed to the Windy City, Chicago, Illinois. We're going to start the walk at Wrigley Park and make our way around the bases. Then we'll head over to the 360 Chicago Observation Deck, formerly known as the Sears Tower. Finally, we'll wrap up today's walk at the Navy Pier. Total distance for today's walk amounts to 7.3 miles, which is approximately 14,600 steps. More than the recommended daily step count endorsed by the American Heart Association. Remember, if you can't achieve the daily step count goal, just do what you can, even if it's only 5 steps a day. The important reminder is to keep moving and keep active. Next up, we travel to Don DeVoy's kitchen for a Chicago favorite on this week's segment of What's in Your Pantry?
Hi everyone, and welcome back to another episode of What's in Your Pantry. Today's walking tour takes us to the Windy City of Chicago, home to tall skyscrapers, loyal sports fans, and very diverse foods. Our feature recipe today is going to blow you away as we take on the Chicago-style deep dish pizza. Now, our version is going to be lighter and healthier, okay? So let's take a look at the ingredients for our light and healthy deep dish Chicago style pizza. For one pizza, you will need 1 tablespoon of olive oil, 1 medium yellow onion, 1 32-ounce can of San Marzano tomatoes, 10 to 15 fresh basil leaves, 1 small head of cauliflower, cleaned, trimmed, and cut into florets, 3½ cups of light mozzarella cheese, 2 eggs that are whisked, 1 teaspoon of dried basil, ½ teaspoon of garlic powder, 1/8 of a teaspoon of crushed red pepper flakes, 5 cups of baby spinach, and salt. Okay, so don't be intimidated by this recipe. There are several steps to it, okay? I am going to show you how you can make some shortcuts. And for the sake of time, I've already done several of the steps for you, okay? So step number 1, we're going to make our crust, okay? So the crust is actually a cauliflower crust. So you're going to take your cauliflower, you're going to add the florets to your food processor or a blender. You're going to make a cauliflower rice out of them. Then that cauliflower rice is going to go in the microwave for about 3 minutes. You're going to cook it, and then you're going to bring it out. You're going to pat it with paper towels. Get out as much water as possible, okay? And then to that riced cauliflower mixture, you're going to add your whisked eggs, the herbs and spices, and half of your mozzarella cheese. Okay, so you're going to stir that all up, and then we're going to put it into our pan. Now, the pan that I use is a tart pan, but you can use a springform pan also. But the key here is to spray your pan very well with cooking spray because we don't want this crust to stick. Okay, so you're going to pour your crust ingredients in the pan, pat it all out, make sure you get a nice crusty side, okay, to hold all the ingredients in, and then this is going to go into the oven at 400 degrees for about 30 minutes. Okay, so while your crust is baking, then we're going to move on to step 2, and the step 2 is making our sauce. Okay, so for the sauce, what you're going to do is heat up some olive oil in your pan. And to that, you're going to add your onion, okay? Now, the recipe has you just cutting the onion in half and putting it in there and then taking it out later. I, however, want the health benefits of the onion. You know, onions are an excellent source of quercetin, which happens to be an antioxidant that has anti-inflammatory properties that help prevent against heart disease and keeps your blood pressure under control. Okay, so I want those heart health benefits. So I actually diced up my onion and sauteed it in the olive oil. Okay, so while that is your onion sauteing, you're going to take your San Marzano tomatoes, you're going to put them into the food processor or the blender, and you're going to puree it. Okay, now an easier step here would be just to buy the tomatoes that are already pureed to make your sauce. Okay, so you're going to add this to your pot, you're going to stir it up, and that simmers for about 25 minutes. Okay, while that is simmering, you take your spinach, you're going to put it in a skillet, and you're just going to, on medium heat, wilt it slightly. Okay, all right, so 3 big steps: the crust, the sauce, the wilted spinach. Now, let's start assembling our pizza. So you're gonna pull your crust out of the oven, okay? A shortcut for this cauliflower crust would be just to buy the cauliflower rice in the frozen section, okay? So you could skip that step. I want to make sure I got that in there. All right, so to your crust, we're gonna add this cheese. The cheese goes first. And you're just going to use the rest of your mozzarella cheese. You're going to put this on your pizza shell here, the crust that's already baked. Spread it around nice. Make sure you get it all the way to the edges. All right. Okay, so you can see what that looks like. All right. All right, so then next comes the sauce, right? So we're going to take our sauce. We're going to ladle this all around our pizza. And I actually think you could probably use this pizza sauce recipe for any kind of pizza. Just like you could use this cauliflower shell for any type of pizza, I think you could use this sauce as well. You know, if you wanted to, you could probably add other vegetables to the sauce, like maybe some mushrooms or green peppers cut up, sauteed. Give you a little boost of some extra vegetables. Okay. All right, so there's our sauce. Okay. Wow, this is going to be awesome. All right, then you take your wilted spinach and you just drizzle it on top. And then this is going to go back in the oven, okay? Because we want this cheese all melted. We want our Chicago deep dish pizza to be ooey and gooey. All right, so this pizza, okay, right here, this is going to go back into the oven, the 400-degree oven, for about 15 minutes until you can start to see the cheese getting all bubbly. Okay, then you're going to take it out, let it rest for a little bit, and then you're going to cut it. Okay, and then this is what it looks like when it comes out of the oven. All right, so the healthy habit for today's show is the following. Okay, usually there is always a way to make a recipe lighter or healthier. Okay, in today's recipe, we took a very traditional Chicago deep dish pizza and we made it healthier by swapping out the thick flour crust for a healthier cauliflower crust, okay? And we made it lighter by swapping out the high-fat cheeses and using a part skim mozzarella cheese, okay? And that can be done to a lot of recipes, okay? You can make your recipes lighter and healthier just by swapping out different ingredients, okay? So don't be afraid to try that. All right, so that brings this episode to a close. As always, thank you for joining me. Until next time, stay tuned, stay healthy, and we'll see you later. Bye-bye.
Welcome back, Mall Walkers. We hope you enjoyed today's cooking demonstration and our healthy habits tip of the day. Because May is American Stroke Month, we wanted to take some time to share with you the importance of recognizing stroke symptoms. In today's presentation, Joshua Adams, stroke coordinator for Excela Health, discusses the mnemonic device BFAST and how you can play a role in identifying and preventing a stroke. Let's welcome Joshua Adams.
Hello everyone, my name is Josh Adams. I'm a stroke nurse coordinator at Excela Health System along with my coworker Diane Dunn. We're here today to tell you a little bit about stroke signs and symptoms and what to do. First off, we want to tell you that there are two types of stroke. There are strokes that are caused by blockages in the blood vessels in the neck and brain that are called ischemic strokes. And there are also strokes that occur when there's bleeding in the brain. Those are known as hemorrhagic strokes. The ischemic type of stroke caused by blockage accounts for roughly 80% of the strokes that occur in the public. The hemorrhagic strokes are the other 20%. And the important thing to note is that stroke is a preventable disease. It's a very time-sensitive diagnosis. It is a critical care emergency. But there are things you can do and steps you can take to lower your risk of stroke and prevent a stroke from happening to you or your loved ones. First, I'll talk about the signs and symptoms of stroke that we want everyone to be aware of. And these can be remembered using the mnemonic BFAST. The B in BFAST stands for balance. If you notice that anyone is having a very sudden change in their balance, they're stumbling, they're finding it difficult to stand up, and this is a new change for them, this is a warning sign. The E in BFAST stands for eyesight, and again, any type of sudden change in your vision or your eyesight is cause for concern for a stroke. The F stands for face, so someone has a facial droop that you notice, observe, or you feel yourself that part of your face is numb perhaps, or you're not smiling the way you normally do. That is a warning sign. A is for arm, so ask the individual to close their eyes and hold out both their arms, and if you notice that one is beginning to drift or maybe just falls to the bed or to the table, that is another warning sign. The S stands for speech. You can ask someone to repeat a simple sentence like, "The sky is blue in Greensburg, Pennsylvania," and assess their speech if they have trouble getting that sentence out, or if they just seem to not comprehend what you're saying. There's a lack of understanding there that we refer to as receptive aphasia. That is a warning sign. And then finally, the T in the BFAST memory device stands for time. Any of these 5 symptoms, the balance, eyesight, facial droop, arm weakness, speech challenges or difficulty are cause for concern, and the time is to really emphasize that it's time to call 911. You need advanced medical care in this type of a situation. Formerly, up until recently, stroke was really thought of as a diagnosis that was more or less a cause of permanent disability or death in many people. And in fact, it is the leading cause of permanent disability in Americans. And depending on the source that you reference, it may be anywhere from the 3rd to the 5th leading cause of death in adult Americans. However, there are many timely interventions that can be performed that increase your chance of survival and increase your chance of recovery fully from a stroke. Here at Excela Health in Westmoreland County, we operate 3 hospitals: Westmoreland Hospital, Latrobe Hospital, and Frick Hospital in Greensburg, Latrobe, and Mount Pleasant, and all 3 of them are recognized by the PA Department of Health and the Joint Commission on Accreditation of Healthcare Organizations as primary stroke centers. What this means is that if you or someone you love is having a stroke, signs or symptoms of a stroke, it is of the utmost importance that you recognize this immediately and call 911. We encourage you, your friends, your family members to react to stroke symptoms rather than regret something that may have possibly been prevented or delayed. So we really encourage the public to utilize 911 in this situation. It's not a diagnosis that frequently gets better with time. It usually gets worse. So if you are of the mindset that, oh, I'm a little dizzy because I was out gardening and I came inside and I'm gonna lay down and put my feet up and see if it gets better and call my family doctor tomorrow, you really should be evaluated in an emergency department and call 911 to do so the paramedics can transport you. This offers the best chance of timely diagnostics and timely intervention, whether you're eligible for a clot buster drug that we use known as TPA, or perhaps a interventional radiology procedure where the clot can be retrieved. The utmost importance is that the signs and symptoms are recognized quickly and that you get help quickly. At Excela Health, we offer the full range of stroke care in our emergency departments, our radiologists, our critical care nurses, acute medical surgical nurses, rehabilitation therapy services, pharmacy. It's a multidisciplinary team effort that everyone is truly involved in and invested in making sure that patients have the best possible outcomes from their stroke, as well as geared with an eye towards prevention. So as we mentioned, the 80% ischemic strokes have preventable risk factors associated with them. Some of the biggest preventable risk factors that you should know about, that you should talk to your primary care or family doctor about, include having high blood pressure, having uncontrolled diabetes, smoking, and obesity, and also having a heart arrhythmia known as AFib can be a highly strong predictor of having a stroke. So if any of those conditions are something you or a loved one are being treated for, we encourage you to see your doctor regularly. Make sure that you are partnering with your family doctor to really control these risk factors that are controllable. The pandemic has brought new challenges to healthcare as a whole, we understand, as well as to stroke treatment. But the other point of emphasis here is that we really don't want anyone in the community to die of doubt or to hesitate to call 911 or come to one of our emergency departments if you're having stroke symptoms or any other type of medical emergency. We're here to serve and to treat you and hopefully restore that level of function to get you back on your feet and in the community.
We want to thank Josh for taking some time to educate us on the types of stroke, signs and symptoms of a stroke, and where to go in the event of a stroke. As he mentioned, Excela's 3 hospitals, Westmoreland, Latrobe, and Frick, are all certified primary stroke centers. Remember, time saved is brain saved. If you or a loved one is experiencing stroke-like symptoms, don't wait. Call 911 or visit the nearest emergency department. We hope you will stay tuned as we feature another presentation on stroke risk factors during our May Mall Walkers Day video, Thursday, May 27th. Don't forget to check your email inbox for today's featured recipe, along with additional resources related to stroke awareness and prevention. Until next time, stay safe and stay healthy. We'll see you soon, Mall Walkers.